So hi everyone, my name's Jenny. It's really nice to meet you. So I'm a veterinary surgeon, and I thought I'd just start by reflecting on how I came to be a vet and when sort of vet life started for me. And then I'll chat through what it is people enjoy about being a vet, sort of all the different aspects of the role, the various transferable skills you've got, because having a veterinary degree opens up loads of career pathways for you. And then also what I do now day to day and how that might vary from other vets. So vet school started for me really when I went to university, because I think although you do a lot of subjects related to veterinary science at school, such as biology, that real clinical side of it doesn't kick in until university. So you really start to feel very clinical and like a vet at university. And university was, for me, was an amazing experience. I think all of the vet schools are great. But moving from quite a small village where I grew up to a big city, so I went to vet school in Bristol, meeting a whole variety of different people. And most importantly, realizing an absolute fascination in the subject. So I'd always wanted to be a vet since I was around about 6 or 7, which I think is really common for a lot of vets. But ultimately, the subject just sort of completely took a grip on me, like the study of animal health, animal disease, and then how we treat that disease was so interesting to me. And there's loads of other skills that you're taught at vet school as well. We do a lot around communication skills, because ultimately a lot of our job is liaising with other members of the veterinary team, but also the public as well. So it's a huge public facing role. And we do sort of various team building activities, and it's just a really dynamic, really interesting degree. So it's a 5-year degree. So I really enjoyed that. So for me, the main reason I find the job really enjoyable is the absolute fascination in the subject. But I think other people arrive at veterinary medicine for other reasons. So I mentioned that huge requirement of really good interpersonal skills, and also the opportunity to feel like you're part of the community. So I know some of my colleagues especially value that aspect of the job, because ultimately, especially if you work in a practice and you stay there for quite a long time, you get to know all of your local clients, and they bring in their animals regularly, or you go to their farms regularly, depending what type of veterinary work you do. And it's just lovely to feel like you make an impact on those people's lives on a week to week or month to month basis. And you really get to know them over years with their pets. So that's a really lovely aspect of the role. Obviously, most of us are drawn to the profession because we've got some love for animals. So that for me wasn't any different. If it's animals that you really love, it is always worth considering other jobs as well. So there are veterinary nurses who get to nurse the patients all the time, and they really do much more in terms of patient care than the veterinary surgeon does. There are also animal care assistants, but there are pet and animal physios as well. So I'm not sure if Sarah knows any animal physiotherapists, but there are equine physiotherapists and dog physiotherapists as well. So there are different options for careers if you just want to get hands-on with animals and you might not want to be a veterinary surgeon. And then for some people, it's the opportunity to spend a lot of time outside. So if you work in farm or equine practice, much of your day will be out on the road in the car, working as part of a wider team, but ultimately day to day, very independent, spending time on equine yards or on farms, chatting to farmers, being outside with the animals, lots of sort of physical activity and skills. And I think certainly for some people, that's a big draw of the job for them as well. And then graduating from a UK veterinary school, we're really lucky because the Royal College of Veterinary Surgeons, who are the governing body who allow you to practice as a vet in the UK, ultimately our degrees are very highly recognised around the world. So there's loads of options to practice all over the world. In some parts of the world, you'll need to do additional qualifications as well to be able to practice. For example, in America, you do need to take state licensing exams as well once you're a vet, but it is a very transferable degree. So you can, with a few little hurdles, ultimately practice wherever you want, which I think is a lovely opportunity as well. Sometimes people go through vet school and they realize they don't want to be a vet, either because they've been fascinated by another part of the degree along the route, or they've realized that the day-to-day clinical job isn't for them. And so there are lots of different government roles in, for example, meat hygiene, or working in the abattoir setting, or in disease surveillance. So there's loads of interesting roles there. And some people prefer to work in more of a laboratory setting, doing research to promote human and animal health for the future. So learning more about diseases, learning how we can treat them better, and ultimately contributing to the wider global health. So in terms of my day-to-day roles varied hugely over the course of my career. So I graduated from vet school in 2008. And the first sort of 5 to 10 years of my career, ultimately, I was 100% clinical, which means I was working like a vet every day. And that would usually encompass getting into work around about 8 to 8:30 in the morning, chatting to the nurses for a bit, having a morning coffee, checking the inpatients were okay, and then normally doing a couple of hours of consulting in the morning. So 10 to 15-minute consults around about sort of 8 clients I'd get through, meeting them, doing routine healthcare like vaccinations, but also seeing pets that have become poorly, and having a discussion with the clients about what they might want to do to get to the bottom of things, whether it was treatment or admitting them for investigation. And then usually you'll have a period of operating. So you leave veterinary school being allowed to operate, and being a competent surgeon. So you then usually spend a few hours of your day operating. So this is in small animal practice, which is what I did. And then the last couple of hours of your day will be going back to the consulting room, meeting more clients, and hopefully helping to resolve more problems in the consult room, and then usually finishing up at the end of the day with a few phone calls. So just updating owners of inpatients on how their inpatients have been through the day, and reporting laboratory results from patients I might have seen and needed to take blood from. So that's a small animal role. I've always done small animal practice. I think you can do mixed practice. So those of you who are interested in veterinary medicine will know of James Herriot, who's the famous vet who lived up in Yorkshire and did mixed practice, where he did a bit of everything. It's much less common to do that nowadays. So the overwhelming majority of people will graduate from vet school and choose a particular discipline to go into. There's so much to know nowadays. The role of the mixed practice vet is much less prevalent than it was, for example, 30 or 40 years ago, when we knew less about animals and therefore it was much easier to be able to keep on top of all the different species. Now there's just so much to know that actually most vets will choose to focus on one area and do it well. Ultimately, over the last 10 years, I've changed my role quite a lot. So I returned to university after 3 years in practice. I went back to university for another 4 years to do a postgraduate clinical training placement, which ultimately enabled me to become a European specialist in canine and feline internal medicine. So I'm basically a consultant for particular diseases that dogs and cats get. So I now work from the University of Bristol, but I just see animals with problems that can't be fixed by their local vet. So much the same as you going to your GP and then ultimately being referred on to a hospital for further investigation. I'm one of the consultant vets. So there aren't many of us. There's probably about 5% of the UK veterinary population do what I do. But it's a really enjoyable role. It's really interesting. And I love it very much. It's just, I get up and go to work every day and I find it really, really interesting. So now I work for the University of Bristol, as I said. So I do approximately 60% of my work is clinical now. So that is seeing patients much the same day as I described earlier on. And then the other sort of half of my role is academic. So I'm a senior lecturer at the University of Bristol. So I now teach other vet students how to be a vet. I teach them specific subjects, both in sort of small group settings and in the lecture theatre, and then on clinics as well. So in their final year of studies, the veterinary students spend time with me doing my consults for me. I watch them, I give them feedback, and they're basically learning to be a vet under the guidance of me and then all the other staff at Bristol Vet School as well. So hugely varied role. And I just thought I'd finish by letting you know sort of requirements to get into vet school. So it's super competitive, but there are quite a few vet schools and there's more spaces all the time in the UK. And we definitely have a shortage of UK vets. So hopefully plenty of opportunity for those of you who are interested. Typically, you need to do science-based GCSEs and A-levels, and I've deliberately been vague because it does vary slightly across all the vet schools, so it's better for you to specifically look up the different vet schools and what their requirements are. Most of them require you to have done chemistry and at least one other science subject, but it does vary, like I say, so do look at the individual universities' requirements. And typically you need 3 A's at A-level to get into vet school, and then it's a 5-year training programme, and you come out the other end as a fully fledged vet. So